Now this one I technically could go through, sorry. We're going to start at the ASIS, and I'm going to go inferior and just lateral. Should be the TFL. I'm going to have her abduct into my hand and then relax. It also flexes, so go ahead and flex. Good. So if I had her flex and I didn't feel anything, then I might not be on the right spot. I might be too lateral, and maybe I'm on like a glute medius as opposed to the TFL. But if I feel both, then I know I'm on the TFL. So go ahead and abduct again. Good. And relax. Good. And then Sartorius, we're going to find, so we're all starting from the ASIS. We're going to go, instead of inferior and lateral, we're going to go inferior and medial. And then I remember Sartorius because it's like kicking a soccer ball. So hip flexion, abduction, and external rotation. So what I'm going to do is, just for sake, I'm going to put your leg there. I'm going to come ASIS inferior medial, and then have you lift your foot up into my hand. This is the part. Try. And relax. Do it again. Good. And relax. How about if you did it here? All right, that's better. One more time. Okay, good. So we're doing it at the proximal insertion. Rectus femoris, we said, attaches to the, right, so we're going to find the ASIS. We're going to find the ASIS and move inferiorly to the AIS. And then we're going to have the patient flex the hip and relax. So, does the rectus femoris abduct the hip? Not really, no, right? So let's have them abduct to make sure we're not on the TFL. So now I realize I feel a little TFL and relax, so I need to just move a little bit central. Now go again. But the trick is now she's lifting her leg. So try to just slide it versus lift. Okay, so just, there we go, and relax. So you can differ, because they're all really close, right? We went ASIS straight inferior was rectus, ASIS inferior and a little lateral was TFL, ASIS inferior and a little medial was Sartorius. So playing with what their actions are going to help you figure out to make sure you're on the right one. All right, Adductor Longus is going to be another starting point for us for several muscles. So they want us to do legs off the edge. And I'm going to do, we're going to use a bolster underneath your knees. You could really do either. Sometimes legs off the edge hurts people's low backs because it puts them into a little bit of extension. So this essentially gives us a similar type position as knees off the bolster, or knees off the edge. Okay, so we're gonna find her pubic tubercle again, and we're gonna move laterally to the ramus. So we're gonna find her pubic tubercle, and then we're gonna move laterally to the ramus. I'm gonna spread your leg out just a little bit there. And then I'm going to come in until I feel a pretty prominent tendon. That prominent tendon is going to be the adductor longus, and then from there we'll orient ourselves to other things. So go ahead and adduct your thigh, and then relax. Good, okay? So we're going to adduct again, adductor longus, and relax. Where does the adductor longus insert?
Middle.
We need aspirate. Good. Okay, so adductor magnus, we know it attaches to the adductor tubercle, but we're going to find it more mid-belly. So we're going to start at the pubic ramus like we did. We're going to find the adductor longus. Then we're going to move inferiorly. They say the words posteriorly to palpate the adductor magnus. We can have the patient adduct and extend as opposed to adduct and flex, and that'll help us differentiate the magnus. So I found her longus, and I'm skipping a few steps because I just remember where it was. I'm going to move inferiorly. Let's see. Grab my, yeah, and a little, they say posteriorly, I'm going to call it medially, and then we're going to have her adduct again. Good, and relax. So I could follow my hands down, keep adducting, until, and this is an awkward angle, I got all the way down to that adductor tubercle, and I should feel the muscle contract all the way down. Do you guys know the acronym Grab My Leg, Baby Please? That's a new one. Grab is gracilis, M is magnus, longus, brevis, Pectineus, and so it's going to be sort of most medial to lateral insertion site. Grab my leg, baby, please. Grab my leg, baby, please.
One more time.
No. I was going to say it has a little Britney Spears connotation to it. I know. Okay, Adductor Magnus. And then Pectineus, we're going to start again. We find the inferior pubic ramus. We find the Adductor Longus. And then we're going to move anteriorly, now laterally, to find the Pectineus. So, and it adducts and flexes. So we come back to that longus. And so now we're going to come this direction. And then, no, I went the wrong direction. Hold on. I don't want to say it wrong. No, I just said grab my leg, baby, please. Okay, yeah, we're going to go this direction. And then go ahead and adduct for me. Good, and relax. And so that's Pectineus.
Say again how you
say that again.
So we're going to start from the Adductor Longus, and then we're going to move a little bit laterally, a little bit inferior, and then we'll find Pectineus.
Where do we find brevis then?
Brevis
We
is too
have
deep
here.
to palpate,
Okay.
so we don't find brevis.
Okay.
And so all I'm just follow the steps in the book. It's pretty laid out, but we're just starting from the Adductor Longus. Whether you move medially, posterior, or they say posteriorly, I say medially. They say anteriorly, I'm saying laterally. Yes. All right, we're going to cross gracilis off the list. I don't like the palpation of the book. So we're going to cross gracilis off the list, but we know that its distal insertion is at the, yeah, because they basically have you start proximal and walk your way all the way down to find the pes anserine. So we're going to skip gracilis. We're skipping gluteus maximus because we did that in lumbar and